our children in St. Lucia who are not vaccinated, it was mind-boggling to me. Because I did not realize, I thought that we had made a lot of steps over the years, and I didn't realize that with time and education, when we should have been a lot more forward-thinking, and that we had perhaps regressed a little bit. And so for me, as a parent, and also from the position in the Office of the Prime Minister, I would like to encourage all parents out there, and even our children who are sitting in our midst, there's nothing to be afraid of. It's just a tiny little prick that will save you from a lot more pricks in the future to come. This program is very important. We have to continuously spread the word, oversaturate our populace with information. Just as the Office of the Prime Minister has to deal with myths and misinformation on a daily basis, so does the health sector. You have to dispel the current myths concerning vaccination. I take the opportunity again to urge any parent who has doubts or questions about vaccination to engage the healthcare professionals and parents like myself who've been there before, and ask all the questions you need to about the benefits and the risk. The campaign proposed will help to accomplish this with the dissemination of clear and accurate information about vaccines and the benefits to the people on the front lines, the teachers, parents, community leaders. This type of preventative approach, which encourages an attitude change in our people, will put the government in a better position to roll out the vision and the reforms that are ongoing in the healthcare sector. We must always keep in mind that we all have a public health commitment to each other and to our communities to protect each other and each other's children by vaccinating ourselves and our own family. I also wish to commend and continue to encourage the work of the delivery unit in the Office of the Prime Minister, who I know played a significant role in ensuring we have the rollout of this campaign today. Once again, I wish you much success with this initiative, and I repeat that you can count on our support. All in, get vaccinated. Thank you.
Protocol has been very well established, so I am going to adopt the established protocol. And I know that we have children here who are kind of getting a bit restless. It is really truly a privilege and an honor to be here with you this morning to again reiterate our theme for today, which is all in, get vaccinated. Of course, that emanated from our national theme for our 40th independence, which was all in, our journey, our future. So our theme keeps resounding in almost every activity and every program that we carry out throughout this year until the end of December. Let me say good morning, everybody.
Good morning.
And thank you for being here with us today. I want to just go through, and of course you've heard it all, our head table, the members of the head table have gone through almost everything that you need to know with you. So I am not going to reiterate some of the stuff that they've already discussed. And by now you have a lot of information on why you need to get vaccinated and also how you can get vaccinated. It is a free service, so I encourage everybody to get vaccinated. It is also a PAHO requirement that we get vaccinated, try to get everybody 100% coverage, vaccination coverage. And as you know, PAHO is one of our health partners that assist us in a lot of areas in healthcare in St. Lucia. So it would be very unfortunate for us to agree that we are going to get everybody in St. Lucia vaccinated at PAHO, and then to come here, to be here in St. Lucia and not really trying to realize that promise. So I want us to be mindful that this is a world initiative to get people vaccinated. We have a lot of, although St. Lucia may not have any case of measles and so on right now, we have a lot of countries that currently have these diseases. And we do have a lot of people coming from different countries that we interact with. So we have to protect ourselves, not only from us here in St. Lucia, but also because of our interactions with other people, visitors, foreigners, tourists coming in, ourselves traveling, going out and coming back in. We have to get ourselves immunized against all these other dangers out there. We saw SARS, we saw what was the other one again? This very bad one. Ebola, right? We see these kinds of things coming from other parts of the world, and we have to immunize ourselves against the possibility of getting these diseases and these viruses. I want to say too that when I was little, and I think Nancy touched a little on taking her baby to get vaccinated and so on. But I think I predate that time in that I cannot recall us having those cards and so on and so forth. Because what used to happen was they would come into the schools and just vaccinate everybody. So that way we got vaccinated. And it was class by class by class. So the Ministry of Health, the healthcare professionals used to keep count and know that on any average day they could tell who had already been vaccinated and what school, what level, what grade had not been vaccinated. I believe that is how it was done at the time that I was little. I do not recall having this little card that they have now. So now you can see we are moving up in strides. We actually have parents in control of getting their children vaccinated, whereas before we did not have that. And I remember them coming and giving some kind of vaccination that was like you would have something with about 6 or 7 needles, and you would have this round thing, and they would just inject that in your arm in school. So your mother was not there to cry with you. Your mother knew nothing about that. You would go back home and she would just see, hey, my child has been vaccinated. So at least now you have more support when it comes to getting vaccinated. Your parents bring you in, they keep track, and they do that voluntarily. So we are asking that every child, everybody in here, I think we may be speaking to the converts, but at the same time, I mean, the teachers are here, some parents, and these are people that already know and already appreciate the need for these vaccines. But we want you to take it out there in the village, take it out there to everybody else and inform them. Tell your classmates whom you believe have not been vaccinated that this is very important. Parents, talk to other parents, teachers, spread the word so that we can get everybody vaccinated. We are going to be hosting the PAHO Executive Council, I believe in September. This is quite an honor for St. Lucia to be hosting such a high-level delegation coming here to have their council meeting. But we want to be able to assure them when they get here that we are carrying out their agenda and to show them that our numbers in terms of vaccination has improved incredibly. So we are asking you to get out there, continue the drive to get everybody vaccinated. Our timing is so very appropriate because this is the year where we are saying we want everybody to be in. And our theme speaks to us getting everybody in. So the most important thing here for us today is for you to understand why you have to get vaccinated and for you to get everybody to come in and get vaccinated because we want 100% coverage from all kinds of diseases and so on and so forth. Imagine if you were to take a position where you know a child who's not vaccinated and the parent is saying, no, I don't want my child to get vaccinated and so on and so forth. And at the end of the day, we have an outbreak of something, and it is those people who did not get vaccinated that gets affected. We do not want that to happen. So we have to take the necessary precautions, and like you've heard over and over again, prevention is better than cure. And you may have heard a lot about OKEU having less beds than Victoria Hospital, and we cannot move, we have to retrofit and get the additional space and so on. But you have to understand the reason why that is so. And the reason is because the people who designed the OKEU designed it with the vision that our healthcare system will be much better, will be in a much better position to so that we would not need so many people being hospitalized. And this is where the vaccination, we can link that vaccination program with what is going on, what has gone on with our new hospital. If we are able to control our preventative care, if we are able to take preventative measures so that people do not get sick, so that so many people do not get all these illnesses, unnecessarily sick, because if you don't vaccinate and you get sick, this is sort of unnecessary. It is important that you get vaccinated. It is free. So you will be preventing yourselves from having to be hospitalized, and as a result of that preventive measure, we do not need as many hospitals as we do now at the Victoria Hospital. So this is just one of the ways that we can practice preventative care, as opposed to allowing yourself to get sick, and then we need more beds in our hospital to facilitate more people who are getting sick. So this was the whole reasoning, the thinking behind the less beds at OKU. That was one of the reasons. That preventative care is going to kick in, and our primary care facilities are going to be utilized a lot more, so that people do not end up having to be, you will be healthier, and people will not end up, so many people will not end up having to be hospitalized. So with this, I want to say, again, our theme, all in, get vaccinated. Our theme is all in, get vaccinated.
Check, yes.
When the race is nearly done, and I feel I can go on, I know I can do something about it. My heart will start to race, my body find the motion, and I will feel the power from within. I've got the power in you, you've got the power in you. I've got the power, the power, got the power in you. No man's gonna hold me back, no man's gonna silence your voice.
Somebody call away. Boy, 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 boy.